Hi friends, I'm Dr. Geotram. Today I will discuss about hyperthyroidism and its treatment. Hyperthyroidism and thyrotoxicosis are used interchangeably. However, each refers to slightly different conditions. Hyperthyroidism refers to overactivity of the thyroid gland with resultant excessive secretion of thyroid hormones and accelerated metabolism in the periphery. Thyrotoxicosis refers to the clinical effects of an unbound thyroid hormone, regardless of whether or not the thyroid is the primary source. There are a number of pathologic causes of hyperthyroidism in children and adults. These include Graves' disease, toxic adenoma, toxic multinodular goiter, and thyroiditis. Graves' disease accounts for approximately 95% of cases of hyperthyroidism. To understand the pathophysiology of the hyperthyroidism, it is necessary to understand the normal physiology of the thyroid gland. This picture showing normal thyroid gland and enlarged thyroid gland or gland with hyperthyroidism. Definition: hyperthyroidism is due to increased level of thyroid hormone, diffuse toxic goiter, Graves' disease, toxic multinodular goiter, Palmer's disease, toxic edema. According to Sanjay Azad, hyperthyroidism is hyperactivity of the thyroid gland with sustained increase in synthesis and release of hormones, according to Wastons. Etiology: ectopic thyroid disease, Graves' disease, multinodular disease, thyroid adenoma, subacute thyroiditis, injection of thyroid hormone, pituitary disease, injection of food containing thyroid hormone, high dietary iodine intake or very low dietary intake, genetic factor. Pathophysiology: hyperthyroidism characterized by lost normal regulatory control of thyroid hormone secretion leads to the action of thyroid hormone on the body is stimulatory. Hypermetabolism result: increased sympathetic nervous system activity, alteration secretion and metabolism of hypothalamic pituitary and gonadal hormone. Excessive amount of thyroid hormone stimulate the cholic system and increase the adrenergic receptors, tachycardia and increase cardiac output, stroke volume and peripheral blood flow. Negative nitrogenous balance, lipid depletion and the resultant state of nutritional deficiency. Hyperthyroidism result. Clinical manifestation: symptoms and their severity depend on duration and extent of thyroid hormone excess and the age of the individual. Individuals may experience nervousness and irritability, palpitations and tachycardia, heat intolerance or increased sweating, tremor, weight loss or gain, increase in appetite, frequent bowel movements or diarrhea, lower leg swelling, sudden paralysis, shortness of breath with exertion, decreased menstrual flow, impaired fertility, sleep disturbances, including insomnia, changes in vision, photophobia or light sensitivity, eye irritation with excess tears, diplopia or double vision, exophthalmos or forward protrusion of the eyeball, fatigue and muscle weakness, thyroid enlargement, peritibial myxedema, fluid buildup in the tissues above the shin bone may be seen with Graves' disease. Investigations: history and physical examination, ophthalmic examination, ECG, atrial tachycardia, thyroid function test T3 and T4 levels, thyroid releasing hormone stimulation test, radioactive iodine uptake, thyroid scan. Treatment of hyperthyroidism: radioactive iodine taken by mouth. Radioactive iodine is absorbed by your thyroid gland where it causes the gland to shrink and symptoms to subside, usually within 3 to 6 months. Anti-thyroid medications: these medications gradually reduce symptoms of hyperthyroidism by preventing your thyroid gland from producing excess amounts of hormones. These include propylthiouracil, and methimazole, tepazole. Symptoms usually begin to improve in 6 to 12 weeks, but treatment with anti-thyroid medications typically continues at least a year and often longer. Beta blockers. These drugs are commonly used to treat high blood pressure. They won't reduce your thyroid levels, but they can reduce a rapid heart rate and help prevent palpitations. Side effects may include fatigue, headache, upset stomach, constipation, diarrhea, or dizziness. Surgical management. Surgical management of thyroid disease. Several surgical options exist for treating thyroid disease, and the choice of procedure depends on two main factors. The first is the type and extent of thyroid disease present. The second is the anatomy of the thyroid gland itself. The most commonly performed procedures include lobectomy, lobectomy with isthmectomy, subtotal thyroidectomy, and total thyroidectomy. Methods or techniques of thyroid cancer surgery: thyroid lobectomy, subtotal thyroidectomy, total thyroidectomy.